Now to the next aspect of history taking and examination, that's physical examination in obstetrics and gynecology. We're looking at abdomen palpations. So after you have taken histories from the patients, probably the patients complained about the stomach, or even if they didn't complain about the stomach, later on you are doing review of systems. That's physical examination of all the basic systems. Of course, the abdomen is very important because the abdomen is the structure that is next to the pelvis. You understand? So if there's any issue in the abdomen, it could reflect to the pelvis. If there's issues in the pelvis, it can also reflect to the abdomen. Now for abdomen palpation, can you see the two-hand approach or one-hand approach? You put your hand like this, okay, then you feel. All right, so either the two-hand approach or the one-hand approach. So it's a very important aspect of physical examination in obstetrics and gynecology, especially during pregnancy. So it will give you quality information about how the baby is doing, okay, about how the baby is positioned, okay, about how the mother is doing. So for abdominal palpations, why are you palpating? Okay, why am I trying to feel all over the stomach for? The reasons is I'm trying to access the uterine size. I'm trying to determine how the baby is presenting, how the baby is lying. I'm trying to see if the woman has many pregnancies or there's issues with amniotic fluid, whether it's too much or too low. I'm trying to identify uterine or abdominal tenderness, okay? The technique overview preparation. So you explain the procedure to the person, like just I just want to check you up. Do you understand? That's you taking consent. They should tell you yes, okay? Then of course, if you tell her to even pull or draw her clothes up, she has already been told. Do you understand? Then make sure that she has emptied her bladder. Make sure that she's positioned supine with a slight head elevation. Then make sure that this is okay. In obstetrics and gynecology, no need to pull up, just draw the shirt up here. So from the pubic symphysis right to the xaversternum, that's where you expose. Okay, then steps of palpation. Fundal palpation, you use the flat of your hand to identify the fundus. Do you understand? Like you use your hand like this, come down till you feel the top of the uterus. Then from there, if she's from week 20 up to 36, you can now measure and guess how old the pregnancy is. Then Leopold's maneuvers, okay, this way you palpate the size of the uterus, okay, and all of that. You feel for the back of the baby, you feel for the buttocks of the baby, you feel for the head of the baby. This will help you know how the baby is lying. Pelvic palpations. You palpate around the pubic symphysis. Can you see? This should be a pelvic palpation. Okay. The fundal height measurement. So when you actually felt for the top of the uterus, from there you can use your tape to measure the length from where you felt it down to the pubic symphysis. Do you understand? So the pregnancies from week 20 up, it will give you a guesswork of how old the baby is. Then you feel for you ask the patient if she feels for fetal movements. Then you can also observe or you feel, okay. Auscultation, you're trying to see if the baby has some heartbeats. So red flags to watch out for: tenderness or guarding. If you are trying to feel for all of this and the woman is complaining that there's pain or she doesn't want to touch some aspects, there's an issue. Then discrepant fundal height. If you are measuring the fundal height and it's not okay in line with the actual gestational age, okay, so you can be suspecting for any issues. Absent fetal movement, if the baby is not moving. So abdominal palpation in gynecology, you are trying to see if there's any complications to the abdomen, like pelvic mass, if there's accumulation of fluid like ascites, then if there's tenderness, okay, all those inflammations in issues like endometriosis and also pelvic inflammatory disease. Okay.